in the house here at South Texas Brain and Spine Center. I'm here with Dr. Alexander, and today we're discussing brain trauma. Now, trauma can happen in your brain with things like cancer, stroke, a brain aneurysm, and according to you, our brain doesn't have any nerve endings, any pain receptors, right?
Correct.
So we don't have the ability to feel those types of things, but what you would feel is the repercussions of an accident or a fall or something like that. So let's talk about what happens in the case of an emergency where there's big trauma to the brain.
So nowadays, most patients, if you're in a car accident, you're wearing a seatbelt, the incidence of brain trauma is a lot less, but there is, neurosurgeons get involved if there's anything that's abnormal on a CAT scan or abnormal on the patient's examination. So our goal for neurosurgery is to maximize their recovery. So depending on how patients present, if they are in a coma, we call it a Glasgow coma scale, how we measure someone. We're at 15 right now, the lowest goes to 3, and there's mild, moderate, severe head trauma.
Okay.
And so patients who have severe head trauma, we will actually put a monitor in the brain and monitor the brain pressures. And we can give medications to decrease the swelling. We can treat things. If there's an expanding blood clot called epidural or subdural hematoma, then we actually remove the piece of the skull, take out the hematoma, put the skull back on. Sometimes if it's severe, recently I had a guy who was car surfing and hit the back of his head. We had to remove the part of the skull, put it in the belly, and remove part of the brain that's non-vital. The brain is not very forgiving, but sometimes, like in a stroke, patients recover over time. And the younger you are, the more your brain can recover over time.
Okay, and real quick for my viewers at home, because this threw me off, let's backtrack to the skull in your stomach. That is to preserve the skull so that it's ready when it's time to put it back on?
Yeah, so if you think of the brain, it's contained by the skull. So the skull protects the brain, but it's also a fixed container. So there's 3 things that are within the fixed container. There's the brain, there's spinal fluid that your brain makes, and the blood vessels. So if you have an increase in one, it's going to cause pressure or decrease in the other 2 variables. So if you remove the piece of the skull, you're exposing it to the air, then it's going to give you the best decreased amount of pressure on the brain. It's amazing how the technology we have nowadays, and also we get imaging and we follow patients very closely. We can put a monitor in the brain, so a little electrode or even a catheter. We can drain the spinal fluid, we can monitor the pressure, so then we can actually treat what you call intracranial ICP, so we can decrease that and increase the brain perfusion. That's the goal, is to preserve as much as we can the good brain, and then if we have to go there and do surgery, we can, but we'd really try to avoid surgery if we can. We can hopefully treat medically. So there's medications like mannitol or 3% sodium that decreases the brain swelling. We can also hyperventilate patients, which decreases the carbon dioxide level, that also decreases the brain pressure.
Interesting. Gosh, there's so many semantics, so many details to this, and of course that's why we hope that a professional like Dr. Alexander and the team here at South Texas Brain and Spine hope that we're in their care if we find ourselves in this situation. But it's important, the more you know, and if you or someone you love ends up in this situation, at least you have the peace of mind knowing there are professionals in our own community that are ready, they're on standby, they're on call to do surgery if it is needed. So thank you for this information today. Don't put yourself in a situation where you need it, but if you do, get in touch with them and mention Coastal Living sent you. Thank you.
Coastal Living's Doctor in the House is paid for by South Texas Brain and Spine Center.